experiencing a new normal. Now, health is a very, very, very interesting topic, and it's something that relates to everyone here in this room. And digital health platforms have grown in importance to offer a wide range of services and will continue to evolve. Now, this next session is going to talk about changing norms and challenging health paradigms. To lead this, our moderator Azran Osman Rani, CEO and co-founder of Naluri, along with him. Let's also welcome panelists Serene Chai, co-founder and head of partnerships and projects of SpeedDoc, Livana Sani, co-founder and CEO of Nala Genetics, and Theodoric Chiu, co-founder and CEO of Intellect. Take it away, Azran.
Thank you very much. Good afternoon, everyone. I'm really excited to host our guests to Malaysia, Serene, Theo, and Levi. So welcome to Malaysia. I have chocolate. It's artisanal chocolate from cocoa, grown in Malaysia, handcrafted. So I wanted to pass this all to you. Welcome to KL.
Wow, thank you.
Just to test, where they land, where does chocolate land on health from your views? Why don't we start with, Serene, if you can tell us one thing about your background that drives you to want to disrupt healthcare?
Okay, so when I was looking at this question, I think, I thought about it from two different angles. What drives me to disrupt and what drives me towards healthcare? And I think the more interesting story is what drives me to disrupt. So that's the story that I'm going to tell. Right? And so I grew up, I think much like most of you, I grew up at the turn of the millennium, right? And it's a very strange time to be. When I grew up, when I was a child, there was no internet. And then I saw global headlines as, smartphones got invented, right? And then I have parents who think that a television set is high tech, right? And I have, 3-year-old cousins that can bypass parental controls on YouTube, right? So it's a very strange place to be. It's a very strange time to be. But what that brought for me was to be able to see global headlines about change makers, right? Smartphones that were invented, and then now you have, smart data and things like that. And I think that really gave me the privilege of perspective, the desire to be a change maker. And I think that is a very unique place in history to be. So that's what drives me.
Awesome. Thanks, Serene. I grew up probably a few decades before the turn of the millennium, but Theo, what about you?
Great. So I think it's a good question. A bit about myself that drew me to starting a company in mental health care really draws from personal experience as well. So professionally, I've been in the tech space as an operator, have been briefly in the venture space as well, but for the most part, mental health care stems from a personal journey. I've been through therapy since I was younger, had anxiety growing up. I think that gave me first-hand exposure towards the benefits of what we're solving for mental health care, but also the gaps in the infrastructure of mental health care in Asia. So that's one of the key things that we saw. How could we actually, not just bridge and improve it, but re-augment and rebuild mental health care altogether. I think mental health care in the space that we're in has been quite stagnant for the most part over the last few decades, and there's good progress being made, but I think there's a lot more that could be done as well. Same with other industries. So stemming from a personal point of view of solving something I personally experienced, basically.
Wow, thanks for sharing and being open. I think it's great that founders can unlock personal stories and passion. Levi.
Yeah, for me, similar story, personal story with my grandpa. Had a lot of drugs that weren't working for him, and so I was working at Genome Institute of Singapore at the time, and figured out that apparently genetic testing is right here for us to use and for us to actually democratize, and so felt like it was a great opportunity. But also I was a product of our time, right? Like at the time, I just graduated business school, and I felt like, okay, this is the way to solve the issue, and it was a combination of both.
Brilliant, cool. So we're all here to disrupt healthcare. Serene, I'm going to start with you again on what's the one biggest pain point in today's healthcare system that you're like maniacally obsessed about wanting to change and disrupt?
I think the answer will be very similar across the panel because all of us are facing the same pain points, and it's an umbrella pain point that has multiple, spokes of pain points under it, which is makes it so painful to be in healthcare. But I think the biggest pain point about healthcare is that it's difficult to change, it's difficult to disrupt within healthcare. And I think that, they will say the same. There are multiple reasons why it's difficult to disrupt healthcare. It's a highly regulated industry. I think everybody knows that. And the worst thing is it's highly regulated for a good reason, right? So you can't, just willy-nilly say, okay, I'm going to disrupt healthcare and everybody's going to be okay with it. It's highly regulated because we care about patient safety, public safety. And then that's another reason why it's difficult to disrupt, because now we're concerning safety, and healthcare, exists within a bubble. People only think about healthcare or think about their own health when they don't feel well, right? And so it's very difficult to approach a healthy, walking individual and say, let's think about how differently we could do things, because people don't want to think about healthcare when they're feeling okay. But that's just, small reasons why the giant umbrella of it's difficult to disrupt.
So if I could push you and say, which one specific stakeholder in the healthcare ecosystem that you've got your target set on that says, we're going to change that? What is that?
I come from Singapore, and the Singapore government is great. I love the Singapore government. They're such great stakeholders, but I have my eye on them.
Yeah. Ooh, I like this. I said on the Singapore government. What about you, Theo?
So I think one of the biggest things that, and I think specific to its our own category within healthcare of mental health, one of the biggest issues we see is that historically a lot of mental health care has been built around the more clinical, reactive side of care, and that stems back all the way towards how we perceive mental health. One of the biggest issues being the stigma around it. We usually seek care for mental health when there is a real clinical severe issue happening. So one of the big things we want to change is moving the narrative from a clinical, distress discussion to one that's more actually proactive, preventative for the masses. So that's a big part of what we're doing. We're building infrastructure that supports clinical care for those who need it, but for the masses that have everyday needs as well, similar to physical health. When you see, a GP for smaller issues, or you go to the gym, we want to support the aspect for the mental state as well.
Okay.
Yeah, for us, I think the number one is payers. Genetic testing personalizes care. And if you think about personalization of care, the cost effectiveness only makes sense in the longer run. There's always this burden in the beginning that has to be paid up front, and then cost saving comes in at a later stage. So,
okay, I'm going to push you there a bit, right? Because while genetic testing could personalize care, how much does it really influence care outcomes? Because people's behaviors, lifestyles, environments can turn your genes off and on.
Yeah, that's a great question. So overall, there's this great chart in New England Journal of Medicine that's about 30% overall average. Obviously, it's higher for something else and then lower for something else. And so in general, genetics is important when you're trying to prevent it much earlier, before any symptoms appear, before any biomarkers you can find. And so that idea of having that data set as a blueprint earlier would hopefully set out a better path moving forward. And who knows, right? I think having that picture in the healthcare landscape is not going to be the silver bullet. We never say that it is, but it's going to be a core component that mental health is going to use, chronic care conditions going to use. And so being able to plug in all these information, make it clinically actionable is one of our core mission.
Cool. Okay, so there are a lot of big players in the healthcare space with a lot of resources. So my question is going to be on how each of you how are you planning to tackle them, right? Because you've got on one hand, Ping An Insurance, they're betting big on Good Doctor. Most insurers have their health super apps. In fact, giants like Apple and Amazon are like throwing a lot into healthcare as the next frontier. All of us are building it from scratch, right? So what makes us think, what's your one advantage over these bigger guys? I'm gonna open up. Who wants to say, here's me?
Yeah, I could go first. So I think this is a good question, and one that applies slightly different towards the space that we're in, and I'm sure you're quite familiar as well as Ron. So mental health care has largely been quite stagnant for the past few decades. I think a big part being that it's not at the forefront of most of our healthcare discussions for the past period of time. So that means that a lot of innovation that has happened to other forms of healthcare hasn't applied the same manners in mental health specifically. So that gives, in a good way, quite a big of blue ocean to actually tackle this category as well. But one of the things that we personally and myself look at is how do we slice the aspects of as a startup ourselves, we're not going to go for the big whole pie that large conglomerates can do. We come in by slicing a certain angle that we do really well and then excel in that aspect better. So I believe that's also something similar that each of the different panelists here do with their companies as well.
Okay, let's go a step further, Theo. If you are a big hospital, the Singapore government, insurance companies, they'll want to know what's your clinical evidence of efficacy or outcomes, right? Because if I'm going to throw money at this, right, is this truly technology that we can put people's lives on? So how would you respond to clinical outcomes?
That's a good question. And this is one of the first things that we actually looked at from day one on our journeys as well. We have our own in-house clinical teams with clinical expertise and clinical researchers on board that helps us build and ensure that we're not reinventing the world altogether. We're pulling all of the best practices from very validated studies, practices in the mental health space, and bringing it into a more scalable digital platform. So how do we marry both the digital and the human touch is what we do. That means running studies just like I'm sure the other companies here do as well. Yeah.
So Levi, when do we see you in the Journal of New England Medicine?
Yeah, not a lot actually. Yeah, so preventive genetic testing is still very, very new. So we're doing a trial right now in Singapore for Raffles Medical Group where every single person that comes into the clinic, whether or not you're sick or you're at risk or you're already sick, you are actually, you can actually take one of our pharmacogenomics tests, right? So that's kind of having the profile of your body. Every time you go to any doctor, you'll be able to say, if the doctor asks you what drugs can you or can you not take, you just show that profile. That's what the future that we are looking into. There's very little evidence right now. There's a lot in the US and the UK, and there's a lot of localizations to be made. And that's why I think it's great to be, to answer your first question about how is this different from larger companies, is that they're not looking into this body of evidence as a key kind of focus for them yet, right? So then building this evidence and making sure that this is an investment that we want to make and being very clear about it with the investors early on is going to be a key aspect of how we do well.
So people who were tested at your Raffles clinic versus people who didn't get a test, is there a difference in outcomes?
Yeah, so we're still recruiting. But at least in terms of patient satisfaction, we already see a difference.
So people who want to volunteer for the test, how do they reach you?
Oh, yeah, so my email is lavana at knowledgegenetics.com.
But
every time you come to Singapore, yeah, let us know. We're happy to.
Awesome. Serene, what specific advantage do you see yourself having over the bigger healthcare providers? And they're big ones in Singapore.
Before I answer that, I just wanted to let you know that I was in a Raffles clinic not too long ago and I wasn't asked. So
it's just starting.
Okay.
You're in the control group.
Oh, okay. So I think my answer would differ slightly, slightly from my two panelists, and it's just because of the nature of my business. And so something that SpeedDoc is focusing on is, doing virtual hospitals, right? And so that's bringing hospital-level care to the home. And recently we were in a patient care conference in Bangkok, right? And we had the biggest and the best players in the world. We had, Mayo Clinic, we had Cleveland Clinic come to talk about decentralized care. So first of all, we know that decentralized care is here to stay, right? And then the second question that we ask ourselves is, how do we work with the big players in the market? And, genetic testing and mental health is very nascent in the market, but hospital-level care is not, right? And in effect, the way we are providing it is changing, but the mode of administering clinical care by a nurse, by a doctor is not. And so I think something that we have to ask ourselves, first of all, if you guys are founders, the first thing you ask yourself is, how do you work with the players or the incumbents, in the market? How do you work within regulations? And I think for our business model, it just made a little bit more sense to be a complementary service to the big boys rather than go head-to-head with them.
Okay. Let's talk about technology, right? If there's one, I know a lot of us do a lot of things, but if there's one aspect of technology that you guys are betting big on, that you think will really set you guys apart from either other digital companies or the incumbents, what's the tech bet you're making on?
First,
Go for it, Thea.
So I think for us, it's twofold. One, it's that given, again, mental health care being quite nascent in Asia, I mean, it's much more mature in the States, and even Europe is just picking up as well. We're starting with a lot of the core fundamentals. We're not trying to be too fancy with what we're doing as well. Providing care that's scalable, but also immersive. That means teleconsultations, supported by different kinds of digital programs and the like as well. But one of the key things that we're looking at is really backing it with strong clinical evidence-based research and processes that we're building in there as well. I think that's one of the key things that we've invested a lot into to ensure that we're not just building just self-care or self-help in some further extent, but very much so evidence-based mental health support that stems and ranges not from just the clinical forms of care, but the proactive ones as well, that we're seeing a lot more actually linkage between proactive mental health towards longer-term, improvement in chronic or more severe issues.
Can I, again, push you a bit, Theo,
Sure.
on being one specific part of the technology, right, that you think, this is what we're really focused on, this one specific problem, rather than the broad, evidence-based care, because I assume you've got developers, so what are you really pushing their effort on?
So for us, it's one of the core, I would say, mission statements, or one of the pieces of what we do here is providing very personalized care to any individual. So for us, that means we provide the care where they need it in the forms of coaching, in terms of therapy, in terms of self-guided programs in place there. And that means delivering it very consistently as well. So there isn't a specific piece, because we believe that, same like if you walk in a hospital, there'll be different aspects that you would need your care for. But that really means holding down to a few key things that we do really well as well.
Okay, so is that like decision support tools?
Sorry, come again?
Decision support tools, or how do you?
Yeah. So a mix of it. We do have our clinical design algorithms, and also make sure that when we actually triage people in need, it's founded by a good amount of evidence as to what their issues are or were, and how we actually provide them care that leads into the best outcomes as well.
Awesome, thanks. Levy,
Yeah.
what's the tech bet?
Yeah, so we do two folds. One is making it cheaper, making sequencing cheaper. And the second one is making it more impactful. So from the cheaper side, we're one of the first labs in Southeast Asia, or not Asia, to actually do low coverage whole genome sequencing, which means that you can actually sequence with lower depth and making it a lot cheaper. But because our bioinformatics tools are advanced and we use localized data set, the quality of interpretation is the same or even better to the local population. So that's where we're innovating. We're hell-bent on this idea of cost effectiveness, which is impact divided by cost. Yeah.
Cool. You know how the adage says, right? You can get it cheaper, you can get it better, or you can get it faster, but you can only pick 2 out of 3. So does that mean you guys are not fast?
Actually, yeah. We have to batch samples. That's true. Yeah, that's the trade-off we're making.
Awesome, thanks. What about you, Serene? Speed Doc. Where is Speed Doc's tech bet on?
What a tough moderator you are. Well, I think I touched upon it, a little bit in my previous answer, but I think something that we're betting on is virtual hospitals, and that means hospital level care, but that also means that we have to invest in the technology that runs a hospital. So we focus a lot on very, non-consumer facing things. We bet very heavily on system integrations, on architecture, on cybersecurity literacy, right? And so you don't see a lot of this, but I think, a lot of our investment in our time, resources, and talent go towards the back-end architecture of being able to work with the best in the market, the best genetic testing, the best mental health providers, so as to achieve the best outcome for patients that are admitted into our virtual hospitals.
So if there was one disease or condition that you're most proud of in your virtual hospital care, what is it, and what's the tech that helps manage that disease virtually? Okay.
And so I think people who are admitted into virtual hospitals right now, they come with a variety of diagnoses, right? There are, dengue patients, there are rhabdomyolysis patients, there are, COVID-19 patients, of course. And some of them are immunocompromised, right? Maybe they have another illness, or they have, something underlying. And I think the most proud that I am, are the patients that need constant monitoring. And what we've done is we've hooked them up to remote monitoring devices. We have put this on a patient dashboard. We have automated red flags. And it's still very nascent, but we're trying to make sure that, our doctors don't burn out, our nurses don't burn out, and clinical decisions, are not made out of fatigue, or, that decisions can be augmented. So this is something we're very proud of.
What's the coolest remote monitoring device?
Oh, the one that we carry, but it's not out in the market yet. You can read about it in the newspapers.
You're not going to show us today?
No.
All right, okay, cool. So one of the challenges with healthcare, right, is how do you actually make a business out of it, right? What's the business model, and specifically, who pays for care in Southeast Asia? How do you guys respectively look at the issue of, where's the money going to come from, and, how do you make this work commercially?
That's a 10-part question. It's a 10-part question because there are 10
well done
countries.
for volunteering to go first then.
There are 10 countries in Southeast Asia, and the payment schemes are different in every single country, and they're different for every single diagnosis, right? Payers for mental health and payers for genetic testing would be very different from, for example, inpatient coverage, which we're still working on, by the way. And that requires government, support as well. And in Singapore, the government support was, to launch a trial for home hospitalization or virtual hospitalization. And they specifically termed it mobile inpatient care so that the insurance agencies in Singapore will be more likely to pick it up as inpatient care in the future. And so I think this is a very multifaceted question, but I think, the best answers would come from these two, which are a little bit more nascent in the industry.
Right, but let's pick something specific to give our audience something tangible, right? Singapore, a lot of care is offered, accessible to the public. So how do you commercialize virtual care in Singapore or in markets like, Indonesia, where, universal healthcare is quite a big chunk of total spend?
I think a lot of it goes down to breaking down what the consumers need. And I think consumers nowadays are very different. And if you come from healthcare or you've been in healthcare for a very long time, there was historically a very long trend of doctors telling patients what to do or what to eat or how to behave. And I think, number one, consumers have access to a lot more information nowadays, so that's one. Number two, consumers are influenced by a lot of the consumer-facing apps. And if you want to be a consumer-facing digital health startup, you have to bear in mind that people are the product of their environments. And people that are, exposed to AirAsia app in Malaysia, or people who are exposed to the Grab app, right, in Southeast Asia, will expect the same kind of payment schemes or the same kind of treatment that they get from these big super apps, right? And coming back down to how do you commercialize a business in healthcare, it's not the healthcare so much the part of it, but to break down bits and pieces of what people need. For example, I think you would break down clinical-based evidence into bite-sized mental health care, or she's providing genetic testing, and we're providing a way for people to get hospital-level care at home. It's breaking down what they don't have in the market and putting it in pieces where you can find payers. This bit gets this payer, and this bit gets that payer. So that's my answer.
Okay, so quickly, B2B versus B2C ratio of revenue.
I'm not sure I can say this, but 70-30.
All right, you just did. Thank you. What about you, Theo? I'm going to put you on the spot. B2B versus B2C, and why?
Yeah, so I'll take one step back and share and talk about the stakeholders in place as well. So I think one of the key things, and rightly pointed out by Serene, it's that different countries, especially in Asia, where it's so diverse and so different. You look at the US, it's one United States, right? But in Asia, you got like so many different countries. But one of the interesting things that we see as well is that the stakeholders typically are quite similar in place. You've got consumers, you've got employers, you've got insurers, and the government usually so. But what each push and support for, it's quite vastly different based on which countries you're in. So for us, and just to answer high level, but not go too deep, we are a B2B2C company, and we focus working with employers a lot, partnering with insurers and the like there. But one of the key things we see, for example, is that in certain countries and markets, not just in mental health care, but other forms of care like elder care or other forms of health care, the government steps in quite heavily to support different initiatives. So there are quite a few stakeholders in place, and I think where we see mental health care today, it's rapidly growing, but we're still in that early stages where the awareness is now quite large scale. Behavioral change is picking up for how we actually invest and build it. So usually the payers would come from organizations and institutions, usually so. But one last one to just add on, which I find quite great for the space that we're in, is that healthcare is not, fundamentally I believe, not a zero-sum game. You don't have one hospital. You get multiple hospitals always needing more space, more beds as well. So I think that's one whereby even if there are large players coming to the category, there's always more that a player can do if they do it well, basically.
So I'm going to, give you an opportunity here. We've got quite a lot of representatives of employers. I've met banks, telcos, airlines here. What's your pitch? Like, how much does it cost to get your service, and why is it a good return on investment?
Yeah, they got to reach out for us to share more. But I think one of the big things that Intellect does is to provide mental health benefits workforces, that it's scalable and comprehensive, also effective fundamentally for everyone, not just to support clinical distress, but one that actually provides care for the everyday needs of people. And that's one that, yeah, I mean, it's a space that's rapidly growing up. You know it as well, even better than I do as well. But yeah, that's how we see it.
Awesome, thanks. Levy, genetic testing, how do you make it commercialized?
Yeah, so the famous example that everyone probably knows about is the 23andMe in the US. So early days, we were really asked by a lot of investors, why don't you just create a 23andMe in Southeast Asia? I think the key challenge to that question is whether or not ancestry is a big thing in our population and whether or not we have enough data sets. So the answer to the question of B2B, B2B2C is that we focus on B2B2C first because we see a lot of genetic testing companies doing B2C and there's no way to differentiate one B2C company to the other. What's one trait more? Okay, like that's cool, so what? So if we can actually make genetic testing evidence-based, clinically actionable, that's a credibility that we want to build our moat in the beginning, and that's what we've done and invested in. And then afterwards, for Series B or whatever that is, you want to say, hey, now we're working with all these like providers. These are all the networks that can already read our genetic testing, can already practice personalized care, because that's not an easy thing to do. Now we are opening it to everybody. Now everybody can have a report that they can go to every single GP and say, hey, this is my profile. This is how I want to be taken care of because I know for a fact that works for me. That's the dream. So then B2B2C with B2B focus in the beginning.
Awesome, thanks. So just to recap, you know, we start by identifying the problem, the tech that we're betting on, you know, the commercial model. I want to talk now about growth, right? Like Southeast Asia, we all mentioned, is a very complex environment, right? 10 different regulatory environments. And how do you guys look at growth for the rest of this year and 2023? What are your one or two biggest priorities, either from a market expansion point of view, a product expansion point of view? Levy, you're ready to start.
Yeah, sure. So a big component for what we need to decide in the beginning was the stakeholder that actually has the budget, and then the market that they're in or specific countries. So within that kind of intersection, we focused a lot on Singapore and Thailand and Malaysia for this year. I think a lot of the growth question for our companies as well is that we don't have a single metric that everyone kind of looks into the way that e-commerce is or anything like that. So I think
like your North Star.
Yeah, exactly. And that is a debate sometimes, right? Like, is the number of hospitals good enough? Is this the number of publications or clinical evidence? And so that is still, for us, it's a number of hospital, number of tests per hospital, and number of reimbursed testing, right? So in general, we see growth in that aspect and then try to be very, very detailed and very execution heavy on on how we develop the strategy.
Cool, Theo.
So I think for us, the next 12 to 18 months or so, a big part of what we're doing is really looking at how do we expand and scale what we're doing beyond just the places that we're in, to do it further up the region as well. We've managed to prove quite a good amount of success in the populations we serve and the lives we cover. So a big part is how do we actually expand it further, quite literally by scaling to more regions. So for example, recently we announced expansion into Japan, for example, where we believe it's a market that has a high need for mental health support, but also quite a high barrier to how care is provided as well. So we look at markets in a way that we believe mental health care can penetrate quite successfully, and then high need and also strong infrastructure in place. And so a big part of what we're looking at is expansion, increasing the lives we cover as well.
It's so inspiring, right? Because there are very, very few examples of Southeast Asian startups making it work in markets like Japan and Korea. Like, what's your X factor? Why do you think you can make it work in Japan?
Yeah, so check in 12 months, but of course we're gonna we just announced our launch there. But definitely we make big bets on the market, and we're not naive in thinking that Japan is a market that's easy to crack. Huge market, right. Third largest economy in the world, but really, really different and from anywhere else. So for us, that means going in strong with local partners as well, right? We brought on great Japanese investors, conglomerates that we partner with to actually enter, and that we believe could actually not just push a startup in, but really change how mental health care is perceived as well.
Awesome. Serene, Speed Doc, where are you growing?
So we look at growth in two different ways, and of course, being a virtual hospital, we look at a number of hospital beds or a number of virtual beds that we have, and sometimes we look at it regionally. So I think it was last year when India had a healthcare crisis, in the middle of the Delta wave, and there was a lot of reports about how the Indian nationals weren't able to visit a doctor or visit a hospitals or get tested because it was so difficult to find one that was available. Right? And so what we did is we found within our team people that were qualified to practice in India, and we managed their conditions from Singapore. So first of all, it's exciting for us that virtual hospitals transcend geographical boundaries, right? And then you come into problems like cold chain logistics across boundaries. The second way we look at growth is the number of conditions that we're able to manage at home. Right, and so right now we can manage, rhabdo patients, for example, because they're all young and they can recover fast. Or we manage COVID-19 patients because there's so much research about COVID-19, right? We manage that at home. And I think the dream is to manage more and more complex conditions at home, right? Scale up our clinical services and manage, for example, oncology at home, or digital oncology at home, digital, for example, more and more advanced and more complex conditions, patients with different comorbidities at home as well. So that's the dream.
Cool. So finally, to wrap up, to give everybody here a bit of inspiration, I want to ask each of you, how are you each managing your health? Are you a role model for your teams and for people here?
Actually, just to start off, I read a bit before this session about yourself, Azran. I see that you're actually quite the role model. You're an Ironman yourself, and I think you do
very
quite
good at ironing.
So I think that's a good example. I can start first. I think for me personally, besides practicing as best as I can, healthy physical practices and physical health, I think one of the key things, and quite true towards being a mental health company, it's having quite clear boundaries for work and life as well. I think it's something that founders, not just founders, but VCs or any professional, especially in this day and age, tend to find quite hard to actually differentiate, given the ways we work today. So that's a big thing that I bet on. It's having clear boundaries for work and life. Yeah.
Mayank, that's for you. Clear boundaries as a VC. Levy.
Work-life balance, or what we call work-life harmony, I guess.
Okay.
Try
can
to
you tell,
implement.
what's the one work-life balance technique that you're like, that's me?
I try to not message my team or even share articles. I used to share articles at night, right? I read articles and be like, guys, this is really interesting article. And then people feel like the thing to reply. I think making sure that boundary exists, making that a culture, and making that a thing that they actually can value and be a part of NALA, and that's one of the propositions of working with us is a big thing, yeah. Outside of that, I run, I swim, I play tennis, as much as possible, just to take things off of work. That would be really nice.
We can't use a Boomerang app add-on so that you can time when your email goes out for the next morning?
Yeah, the schedule sent. I love that feature. Yeah.
Serene.
Yeah, I think health within a company is very much like running a business. Very much, it's a lagging indicator of different decisions that you make that might not seem significant on a daily basis, right? So I try to treat every member of the team, make sure that they feel seen, make sure they feel heard, make sure that if they are hurt, that there is, no repercussions or no consequences. So there's psychological safety. And I think these are very boring answers, but I think every boring decision that you make in every hour of every day, turns out to be, a better decision in the long run.
Wow. Well, thank you very much. Healthcare may be boring, according to Serene, but as you can see, we've got an amazing, colorful panel, a group of disruptors. Before we get kicked off the stage, I just want to see whether anyone's got burning questions for any one of the panelists. If you want to just grab the mic, because I haven't been kicked off the stage yet. Any questions from the audience? Jing, jing, jing.
I have a question for Azran.
Oh, wow.
What is your work life? What is the answer to the last question? What is it for you?
What is my work-life balance? 7 a.m. to 8 a.m. Mornings, because if I can get my workouts done first thing in the morning, then work happens after that, right? Because if you try to do anything in the afternoon or evenings, it just gets completely messed up. So I protect 7 a.m. to 8 a.m.
Scheduling.
Anyone else? All good? Great. With that, thank you very much, guys. I hope this was a useful and fruitful conversation on disrupting healthcare. And passing it back to you.
Thanks,
Enjoy the
Ezra.
chocolate.
And I do agree with Serene. The health of the team is the health of the company. Thank you all for your thoughts on that and thoroughly interesting topic. A lot of robust discussion happening here. Now, from gaining a better understanding on maintaining a healthy lifestyle, let's now move on to discover the unprecedented challenges from the transformation of the world's food system and its environmental and societal impact. Now, food is a topic that relates to everybody here, literally everybody here, and it is a big business. The next session is the next gen change makers inspiring a new food future.